Welcome to another Q&A session. We have Barbara here who's going to kick off with the first question.
Our first question is from Hannah. I had Botox on my forehead 1 month ago, and now I want to get my crow's feet treated. The clinic told me I had to wait 3 months before getting Botox to avoid Botox resistance. Is this true? Is this a problem even if I'm treating a different area?
So I don't think that is a problem. We do like to leave time between Botox treatments because of this theoretical risk of resistance. But when you're treating a different area, that rule doesn't apply. So she's had the forehead done, and then you're going to do the crow's feet. And typically I may well do this with new patients where they're a little nervous perhaps. And when I get them back for the review at 2 weeks, I may well end up doing the crow's feet. So the answer is no, that's absolutely fine to proceed.
Okay. Brian has a question. He wants to know, I have a vertical indentation line between my eyebrows. I have had Botox, but the dent is still there. I can feel it. I can see it when the light shines on it. I heard that filler is risky in that area. Is there anything else I could have to get rid of the dent?
Probably not. That dent or that static line or groove is probably not going to go away. It sounds like you've had the Botox, and if you have very little movement left of that area, then that's going to remain. And quite frankly, the best thing to do is actually to use a filler in that area. Yes, it is a risky area, but there are a lot of risky areas in the face anyway. In the hands of an experienced practitioner that's done a lot of this is really not that difficult. And when you combine it with Botox, you're also going to get a result that lasts a long time. So recommendation is to find someone, an experienced practitioner, and do the filler.
Well, Brian, do some research. Find a doctor or nurse or practitioner who has credentials, number one. And number two, see pictures. Ask to see pictures of people who have had filler to eliminate the frown line. Okay, yeah. Rebecca wants to know, she recently lost weight and noticed her temples have lost volume. One side is narrower. Can fillers correct this?
Yes, they can. So losing volume in the temple can be can occur from a number of reasons. Typically, I treat this a lot, but in an older patient where they'll lose volume in the temple. And I think it's more in the female, more noticeable, because typically they have more curvature around this area as opposed to the man that has a more square or angular face. If you are a younger person and you've lost a lot of weight for whatever reason that is, then again, you can put filler in that area. And typically, it's either placed superficially or deep. I personally like to place the filler deep because I think you get a much better result. And typically, that's where some of that volume has been lost. You can use both, actually, superficial and deep placement of the filler. I think the concern that people have using the filler at the deep level is, again, we're back to that sort of risk aspect. But again, if you know what you're doing and you know your anatomy, it shouldn't be a problem.
Okay. Janine is asking, I'm 31 years old and my face looks a bit gaunt. What would you recommend? Fillers?
So at a young age where you are looking gaunt, and I've again had a few patients like this too, typically we are looking at both deep and superficial fat compartments, and you're going to have to treat both. Depending on where that volume loss is, depends on what type of filler you're going to use. So typically in the deep compartments, you're going to use a much thicker filler, but you're going to be careful about how much you use. And necessary, I would always, treat someone and get them back for a review, because you can always put more filler in You want the filler to also integrate with your own tissues and look natural. If you're using if you're looking to address the problems in the superficial fat layers, again, you're going to use a filler, but it's going to be a little bit more softer, not so thick. And again, I think the best approach is still is less is more, which is something I've been doing for 20 years. It's easy to put more in. You can't take it out once it's placed.
Okay, good advice. Julie is asking, I have tear troughs and darkness around my eye area. I'm very nervous about treating the area with fillers. Is there another procedure I can have to fix this?
Well, tear troughs specifically are usually from volume loss and best treated using a filler. It's an advanced technique. And again, this is something I love doing. But again, you're looking to do something on a very less is more basis. You should get patients back and build this up slowly. With regards to the dark circles, this may be a genetic aspect in terms of you tend to see it more in the Asian community, so it's more inherited, or it may be due to disease, dehydration, all sorts of other things. So these are other questions you should be asking your patient. We can treat the area using retinol. It's a very good one for pigmentation. And there are some other products you can use, but that's a good one to start with, certainly.
Okay, that's it. No more questions.
That's it. Thank you. If you do have any more questions, please go to my website and submit them there. Thank you.